recording. Okay, so usually you're going to have all three layers, but when you get to that capillary, you're only going to have the tunica intima. Okay, so I'm going to go to the picture, and we're going to look at what these three layers look like, and then talk about how the artery is different from the vein. Okay, so here's our two pictures, and we have the model that looks like this in lab, right? Here's our artery on this side, vein on this side. Now, first we look at the artery. This outside part right here, this is the tunica externa. The tunica externa is mainly made of collagen fibers. What's a collagen fiber for? Now, elastic fibers are for stretch. What's a collagen for? Strength. This is just what gives the structural integrity to your blood vessels, just the strong part. Then if we go in, we see our next layer right here. This is the tunica media. The tunica media is made of smooth muscle and elastic fibers. Why do we need muscle around our artery or our vein? Does it move? Yes. What's going to happen to this circle if I contract my muscles? It's going to squeeze. That's called a constriction. What is it called when my blood vessel relaxes? If you've ever heard the term constriction and dilation, that's the blood vessel getting smaller and bigger. Okay? Then the very inside layer right here, this tunica intima, that is simply made of a simple squamous epithelium. Okay? So does that make sense that the capillary would only be made of tunica intima? What was the function of simple squamous endothelium? To allow stuff to diffuse and pass back and forth. So the capillary is just that simple squamous epithelium so stuff can pass back and forth. That's the point of the capillary. All right? So now that's what this picture is showing you here. It's just the endothelium. So what's the difference between these two? They both have all those layers. Let's look at the tunica externa. Does it look very different between the two? We're looking at tunica externa. There's no muscle right here. No real difference there. Okay? Then, but if we look at the artery, what's hanging out inside of the tunica externa? There's some elastic stuff. So the externa is the same, but if we keep going in on the artery, we've got some elastic layer. Now let's look at the tunica media. How does it look different between the two? The artery has a much, much thicker tunica media. The artery has more to do, right? It's got to contract. It's got to constrict and dilate, control the blood flow through the body. The veins are just trying to get the blood back to the heart. Okay? So we got a thicker layer. Then again, you got another layer of elastic over here in the artery. Excuse me. Now let's look at the endothelium. Does it look any different? The opening looks different in the valves. So the vein has a valve. That's just because we don't want our blood to backflow. That valve catches. Veins are the only thing that have valves. And what you guys are talking about, the opening being different, that's not really a difference in the endothelium. That's just a difference in the structural integrity. Arteries always maintain a circular shape. Veins will collapse. It's not really a difference in the endothelium. That's just where you can see it the best. Okay? So I wrote your three differences on the slide for you, but I think it's important to be able to look at the picture, see the differences. Okay, so let's keep going. All right, there are two major different types of arteries. There are elastic arteries and muscular arteries. Elastic arteries are the ones that come straight out of the heart. They have super, super thick walls and lots of elastic fibers in them. Why do we need our arteries that come right out of our heart to be thicker and have more elastic? Where would you need a thicker water hose? Coming straight out of the faucet where you've got tons of pressure building up when you turn it on, or 2 miles down the road where the pressure's had time to fizzle out? Right at the beginning where that pressure builds up, right? So that's why we have elastic arteries coming straight out of the heart. After we leave those first branches coming straight out of the heart, the artery becomes a muscular, thick layer of muscle. It can constrict and dilate, controlling how the blood flows through the body. Okay? We've already talked about arterioles. Those are just smaller, heading into the capillary bed. I don't want to repeat myself too much, but I want to make sure I say everything. Difference between a vein and a venule. Veins are much larger in diameter. They are what is going to ultimately drain back into the heart. The venule is just the endothelium, really thin thing that drains the capillary bed. Okay? Now, this is the part that a lot of people have a harder time visualizing. So what I did on your slide is I wrote a few definitions that I want to go through with you, and then we'll talk about it and we'll think about this a little bit. Okay? The first definition is your blood flow. Your blood flow is the entire volume of blood flowing through your vessel, your organ, or your circulation. When people are talking about blood flow, they have to define what they're looking at the blood flow in when they're discussing it. So if I wanted to know what the blood flow through my femoral artery was, then that amount of blood that flows through my femoral artery in a certain amount of time would be my blood flow. Or we could say, I want to talk about my blood flow through my entire body. You determine what portion of the body you're talking about. Okay. Next one is blood pressure. Now, we all know blood pressure, right? Some of you could probably tell me your blood pressure. What does that mean? What's bad, a high blood pressure or a low blood pressure? Well, both. It depends on how low it is, I guess, right? But usually people are more concerned with why? What is it? I think that's kind of an important thing to understand. What really is blood pressure? Okay? Your blood pressure, by definition, is the force per unit area exerted on a vessel wall by the blood within it. Well, that sounds horrific, right? Let's think about it this way. If I, excuse me, if I had a balloon, right, and I started blowing up a balloon, what am I doing? I'm putting air in it, right? The more air I put in, it expands and it stretches. It also does what? It gets thinner and thinner and thinner. What happens if I put too much air in that balloon? It's going to pop. Why did it pop? Because of all the pressure that I'm putting on the wall of that balloon by the air in it. Okay? So when we're calculating our blood pressure, we're looking at how much blood do we have in our artery or our vein that is pushing on the wall of that blood vessel at a time. If your blood pressure gets too high, that means you've got too much force pushing on your blood vessels, and you're stretching your blood vessels out. All right? Now, are your blood vessels going to pop like a balloon? It's important to be able to make that connection between that's really what we're looking at, is that pressure that all that blood is putting on there. Okay? When we take our blood pressure, we're looking at the blood pressure in the bigger arteries near our heart. Now, we don't take it up here by our heart, right? We're looking at it further away, but it's calculating the pressure there. Is the pressure in an artery this big around by your heart going to be exactly the same as a pressure in an artery this big around down in your leg? The pressures are going to be different. So we just have to pick a place that we're going to say is the standard blood pressure place we're going to worry about, so we can set standards to say if it's above this, it's too high. If it's below this, it's too low. Okay? So why is looking at vessels coming right out of our heart, right? And these arteries coming out of our heart. Why would it be bad for our pressure to be too high right here? What's the heart doing? Squeezing, trying to push it out, right? If there's a big pressure right here, that means there's a whole bunch of blood right here, right? It means your heart is really having to work hard to get that blood out of there. Why would it be bad if our blood pressure is really low? Kind of the same thing. It's working really hard trying to get enough blood to come out of there. So that's why that was the correct answer. High blood pressure and low blood pressure can both be bad. It's just more common for people to have high blood pressure. What normal habits give you high blood pressure? Eating too much salt, eating too much what else? Fat. We're from the South, right? We love to deep fry everything. Okay? That's a really, really bad habit. Okay? Because, so the salt's actually a little harder to explain, but every one of you can explain to me, why would having fat in your blood give you high blood pressure? Clogs it and it makes it thicker. Okay? The fact that you can already think through that means you know some of these definitions down here already. Okay? Resistance is an opposition to flow. What can make it harder for your blood to flow and make your blood pressure higher? The first one was the one you guys picked out, blood viscosity. If you have fat built up in your blood, it makes your blood thicker, makes your blood pressure higher. There's something resisting the flow of your blood, and it can't move through your body like it wants to. Okay? When you get plaque built up, you can actually get a big clump of fat built up on the side, and the blood actually has to go around it. When you get a blockage, that's when the fat comes across and almost completely blocks something. Okay? There are other things that can affect your blood pressure. The length of your blood vessel and the diameter of your blood vessel can make a difference, which is what I was explaining with why do we monitor blood pressure in the same general location for everybody? Because it's going to be different depending on how big around it is, how long it is. It's going to make a difference. Okay? So do we understand how important blood pressure is? That was the goal. All right? So when you take your blood pressure, you get two numbers, right? Why do you get two numbers? Systolic and diastolic, right? Okay, does anybody know what that means? Good. When it contracts and when it relaxes. Which number is higher, the top number or the bottom number? The top number is higher. Why would the top number be higher if it's the systolic pressure? Because the heart has just what? Contracted. So of course you're going to have more pressure, right? The blood is leaving your heart, so you've got to have a higher number. Okay? Normal is considered 120. If you are at 130 or 140, are you okay? Yes, you're okay. When do you need to start to worry? I don't know. I'm not a doctor. Does anybody know what the level is? Is it 180? Some people I know get up in the 200, 170. At 170 then is kind of the number when you are supposed to start worrying about it. But if you go to the doctor and it's 165, I have a feeling you're going to get that stern look. Okay? The diastolic pressure is lower. That's the pressure relaxes. Not just the heart's going to relax, but your vessels, your arteries are going to kind of recoil too and relax a little bit. Pressure goes down. That averages somewhere between 70 and 80. That's actually the one when that one gets high, really start worrying because that means your heart's not relaxing. It means when your heart relaxes, you're not lowering the pressure enough. So when you contract it again, you've still got high pressure. You can really build up some pressure. Okay? Now, you're probably not going to have a blood pressure of 120 over 70. And you're okay. I'll tell you guys, when a nurse takes my blood pressure, they usually hear it, and then you see them kind of start looking at me, and then looking down at the thermometer. I always say it funny, the little thing where they're watching it, because they're thinking, did I miss it? My blood pressure is around 100 over 60, 100 over 55. There's nothing wrong with my heart. My heart's actually very healthy, but I just have a lower blood pressure. Okay, and a lot of people in this room are going to be very healthy and have a 140 over 80 or something like that. That's perfectly fine. Okay, so what's your pulse? What is that? You can calculate your pulse, how many times your heart beats. Where are you feeling it at? Where do they usually take your pulse? Right here. They're taking it in your radial artery. Okay? What they're taking, it's the pulsation, it's the throbbing that occurs on that artery as the blood flows through it. That blood is coming out in pulses out of your heart, right? Your heart contracts, squirt some, squirt some, squirt some. What you're feeling down here is the squirt rhythm of the blood coming out of the heart. So they can use that to figure out how many times did your heart beat, because every time it throbs, that was the heart contracting and squirting blood out. You can take a pulse at any of the positions on this little guy right here. You can feel it. They're going to take it here at the radial artery. When you're trying to take a baby's pulse, you don't use the radial artery. It's really, really small. I know in CPR class they teach you feel for a baby's pulse right here on the inside in your brachial artery. Okay. A lot of times they'll also use I can't remember what it's called, but there's one right up here by the temple, and they'll feel that with a baby. It's really gross when babies are really little and you're watching them. You can see it pulsating up the side, in the top of their head, in their soft spot. It's kind of creepy, but you can see their little arteries going one right after another. Okay? So I'm not going to test you in huge detail on blood pressure and those definitions or anything like that. But I think it's important to kind of have a better understanding of what that is. Because I can remember being in school and I knew, yeah, I know what blood pressure is. Not really. Nobody ever made the connection between what we were talking about with the heart beating and what a blood pressure was. So that was why I wanted to kind of go through that with you. The main thing we're going to do in this chapter is learn where our arteries and where our veins are. Okay? Now I put quite a few pictures so I could point some things out to you. Okay? But here's what I want you guys to do for me. I want you to start with the big picture. So start with the full picture of the guy and locate the important arteries, and then go to the big picture of the guy with the veins and locate the important veins. If you can learn those for me, then when we start looking at the smaller ones in all of the blow-up pictures, it'll make a lot more sense to you. So let me give you a way to study this. I want you to start at the heart. From the heart, we already know the major artery that comes out of the heart and arches up. Aorta. The aorta comes up, arches, goes down the center of the body. This is still the aorta. It didn't change. It just arched down, up, and comes down. Once it comes down in the center of the body, we call it the abdominal aorta. But it's still just the aorta, okay? All of the organs in our stomach have a branch off of the aorta that feeds blood to them. And that's what I mean by the little blow-up pictures we're going to look at together, okay? But you need to understand this is the aorta. Branching off of the top of the aorta, we have 3 arteries, okay? This first one is called the brachiocephalic trunk. What does trunk mean? The base, and multiple things are going to branch off of it. Brachiocephalic trunk. Then the next one, which carotid? It's the common carotid, but it's going to be the left. It's going to go up the left side of the head. Okay. The carotid goes from here up to your head. So what's the job of the carotid? Get oxygen to the brain. Okay. Then the third branch is the subclavian, goes over the shoulder. Which subclavian is it? The left subclavian. This brachiocephalic trunk branches into what's called the external carotid, but eventually becomes the right carotid and the right subclavian. If you can get that part, everything else is named by where it is. So that's really just the one part I guess you kind of have to memorize. After that, coming down the brachial region of your arm is the brachial artery. Then it branches, and we have one called the radial artery, one that comes down the ulna called the ulnar artery. So those are easy, right? When the abdominal aorta branches into 2 large branches, it does so in the iliac region. So those are the external iliac arteries. Then we have a major artery running down the center of and that's the femoral artery. Once you get lower in the leg, it does get a little more complicated, but the major ones we're going to learn are the popliteal artery. Where's the popliteal? Behind your knee. Okay. Where would your tibial artery go? Down tibia, the large bone, runs kind of underneath that tibialis anterior in the front. Well, I mean, yeah, you do, but you should be able to figure them out. If it's more towards the front, it's anterior. More towards the back, it's posterior. What they actually do is one runs more on the top of the tibialis anterior, one runs deep to the tibialis anterior. Okay? So start with this guy. I want y'all to have him figured out. This is what we did for lab. So y'all have a lab test this Thursday. So y'all need to know this guy for sure by Thursday. The other one I hope you know about for sure by Thursday is this big guy. Okay? It's the big guy with all of his veins. Same thing. Start with the heart. What are those big ones coming out of the heart going to be called? Superior vena cava and inferior vena cava. We're going to look at pictures on Thursday of how all of these drain, but everything else is the same. Instead of carotids up here, we have jugulars. You don't need to learn the 15 different jugular branches and all the vertebral veins. There's a lot of them that drain the brain. So I just want you to know the two major branches, which are your two different jugular. Okay, you don't have to know all those teeny tiny ones in the brain. Okay. Other than that, what's this one going to be? Oops, sorry, right here. Brachial. What's this one going to be? Radial. Here. Ulnar. Iliac. Femoral. Tibial. Now, there is a different vein that we did not see with the arteries that you do need to know. That's the saphenous vein. So that is an important one. They do a lot of things with the saphenous. Sometimes when they have to have replacements, they'll take portions of the saphenous. A lot of people that have, varicose veins, a lot of times that will start in your saphenous vein. So that's one you would actually could hear. Mm-hmm. I don't even see it. I don't know what you're talking about, so I'm guessing no. Oh, mesenteric. No, we're going to look at those. The mesenteric is just part. When we get to the bigger pictures, we're going to look at those. Okay? But what the ones that I just went through with you verbally, those are the ones I would expect you to be able to see on big pictures like this. Okay? I mainly wanted to do it today because I wanted to review for lab as well. Okay? All right, next class.